To arrest this intergenerational transfer of malnutrition, we should act, and we should act decisively. I'm glad to say a lot is happening and we're doing our best, but still the problem is so big. We all need to come together. We don't need anything new. We need to correct this implementation failure. We need to correct the apathy of people not utilizing these services.
Today we have with us Dr. Rajan Sankar, Senior Advisor at Tata Trusts. A physician by trade, Dr. Sankar specialized in internal medicine and began his professional career in the Indian Armed Forces, where he served for 24 years. Once he retired from the army, he began working in the realm of public health nutrition with a focus on equitable scale-up of probe and high-impact nutrition interventions. He has also worked with global organizations such as GAIN and UNICEF and occupied many prominent roles in the nutrition sector. Over the last 5 years, Dr. Sankar has been with Tata Trusts and founded the India Nutrition Initiative. He still continues to serve as a senior advisor for their nutrition programs. Dr. Sankar, lovely to have you with us today.
Thank you very much. It's my pleasure.
Thank you, sir. So I think, sir, you have a very illustrious background and you've had a very illustrious career up until now. So we would like to know a little bit more about that. What got you interested into medicine and then, why you joined the army. So tell us a little bit about that, sir.
Thank you. See, as soon as I completed my undergraduate studies in Chennai in medicine, I joined Armed Forces in 1976. Then I specialized in internal medicine and I was posted in one of the best equipped tertiary hospitals in Bombay from 1981 to 87. Then I was posted to Sikkim on deputation to government of Sikkim. This is something in those days, the armed forces were filling up the gaps in the government service for specialist positions. When I got posted to Sikkim, it was a big shift going from a tertiary level hospital to something like a primary healthcare center in Sikkim. And that is where I also came across the glaring features of iodine deficiency. I saw almost every manifestation I had read in textbooks. Then with the help of the government and my colleagues, we did detailed epidemiological studies of iodine deficiency disorders in Sikkim. And in the next 5 years, I stayed there. And we were happy that Sikkim's IDD control program is a big success and that virtually has eliminated iodine deficiency disorders from that state. Following that, I was posted in the Defense R&D to head the Thyroid Research Center, and then I did my training in epidemiology and moved on more into public health nutrition. And as you described, on retiring from Army in 2001, I've been largely working in public health nutrition. I've had the opportunity and privilege to serve with many, but the last 5 years has been a kind of a dream job, working with one of the most credible institutions of this country. And I had the opportunity to really ride the wave. The last 5 years has been the time of great investments in nutrition in India. And I've had the privilege to ride that wave working for one of the most credible organizations, Tata Trust, in India in the last 5 years.
Right. That's wonderful, sir, to hear about where you came from and what you started. So now let's talk to us a little bit about your time at Tata Trusts and your journey with the India Nutrition Initiative and what the vision behind that initiative was.
See, when Tata Trust had a big shift in 2013-14 in the sense that they identified few areas to, it has its set work streams. They've been there for, the Tata Trust is in its 129th year of community service now. So in that phase, I was handed over a very brilliantly done nutrition strategy and clear things of what we need to do. The main mantra was that we know in nutrition what to do and we have the means to do it. It is a time to scale up proven interventions and to work largely with the governments as well as with the civil society and private sector, who all have the capacity to scale things up, scale, speed, and making a difference. This is our mantra. So we started it, and just to help the trust implement these programs, earlier we were always giving, the trust was providing support to many civil society organizations who came up with very good ideas.
Right.
But here the big shift was the agenda, we owned the agenda. The trust decided what needed to be done.
Right.
And we identified partners with whom we would implement it. We were not just writing a check or being a donor, but being a catalyst, being an implementer. To do that implementation, the trust wanted to set up a special purpose vehicle, that is the India Nutrition Initiative. So in the last 5 years, we've been able to implement a number of programs through this vehicle.
That's great, sir, and I wish you all the best for everything that you have in store for the future. Now, you spoke about iron deficiency being a problem that you've worked extensively on, but when we look at traditional nutrition agenda, we focus on malnutrition and AIDS and those kind of issues. So why iron deficiency in particular, and why is that such a big problem?
Yeah, I think iron is of course important, and iron deficiency is a major focus. Anemia is a major focus for the Tata Trust. My past work has been on iodine. I said iodine deficiency, but Tata Trust has been a big contributor to the country's fight against iodine deficiency, and now they want to focus more and more on iron deficiency. Anemia, as you know, is such a major public health problem in India. Nearly half of the women of reproductive age group suffer from anemia. Children below the age of 5 years, and particularly from 6 months to 36 months, if you see the anemia levels are again close, more than half of the population in that group has anemia. The major underlying cause for anemia is iron deficiency. Anemia can be caused by a number of causative factors, but an important one is iron deficiency. So there are many ways by which you can overcome that, but like you must diversify diet and eat right, but that's always not possible for several reasons. It's not available, it's a behavioral component as well as affordability. Next is you can provide supplements to people who need it. Some say children, pregnant women, adolescent girls, that requires a delivery channel. The third is what we call food fortification. That is, you identify commonly eaten food and add the missing nutrients to it. That way, these three are complementary strategies. They're not, in many situations, you need more than one. Tata Trust felt that food fortification as a strategy has been grossly underutilized in India. In many industrialized world, food fortification has helped virtually eliminate many nutritional disorders like goiter, rickets, beriberi. So we thought it is time we should focus on that. So one of the things that we took was iron fortified salt. That is, we have all edible salt mandatorily iodized. How can we add iron to iodized salt? The National Institute of Nutrition in Hyderabad had come up with a technique to do this several decades ago, and they've been scaling up. Tata Trust worked with them as well as brought other newer technologies to make dually fortified salt. That is, the salt will have both iron and iodine. We've brought in new technology. We've created the base of manufacturers to produce it, and it is slowly scaling up. The other fortified food to carry iron is rice. Tata Trust has two programs, one in Andhra Pradesh, one in Maharashtra. In Andhra, it is reaching more than 10 million children. In Maharashtra, it is already scaling up to few districts in Gachiroli and few others. This have created a model for fortifying rice. And we're very happy that lessons from these have been taken for the government of India in its large pilot across the country in 15 districts.
Yeah. I think this is a big step, that you have taken. Such a unique approach. You see a lot of nutrition interventions that are focused on either providing food or providing the right kind of messages. But I think this becomes like a holy trifecta when you're, approaching it from all the three angles and making sure that people are equipped with, the right nutrition at their disposal. So that's great to hear, sir. And now just shedding some light on the current situation, because COVID has put a big kink in all the efforts that have been made thus far when it comes to nutrition, and is also likely to worsen the malnutrition problem that we have. So what do you believe is going to be the long-term impact that we are going to see, and what can we do to mitigate this impact?
As you put it, it is a problem. It is a very big problem because this virus has disrupted the entire supply chain. And any one of these crises that occurs, the worst affected are the poor. And in poor household, the worst affected would be women and children. And they are the most important groups when it comes to tackling malnutrition.
Right.
And they are the ones who are going to be affected. But the brighter side of it is we know what to do, and we have the means to really do it, and there seemed to be the will to do it. Even early on in the lockdown, the central government, various state governments prioritized trying to keep the ICDS services and food supplements going as much as possible. Right. So there are difficulties. It's not uniformly done everywhere, but very early on in the lockdown phase itself, this was prioritized, and hopefully with all the efforts, we are able to see that the ICDS and primary health services are brought to a level where they can serve the poorest and the most vulnerable well.
Right.
We need to do this for several reasons. If the pregnant women go into a state where they're not eating optimally, not nourished optimally, then that is going to result in a generation of children. You could call them as COVID generation of children.
Yeah.
And it won't stop at the COVID generation of children. Their next progeny, again, will be children of COVID generation children who may also be stunted. Yeah. So to arrest this intergenerational transfer of malnutrition, we should act, and we should act decisively. I'm glad to say a lot is happening, and we're doing our best, but still the problem is so big. We all need to come together. It can't be done only by the government. And it's glad to see, I've been working in Rajasthan. We have information coming from Andhra Pradesh and Maharashtra, where our teams are in the field, where our partners are working at block level, at village level. We hear very good, very encouraging accounts of how all have come together to do their best to mitigate the sufferings for the poorest.
Yeah, absolutely right. I think we don't really realize what a domino effect this is going to have, and how penetrative this thing is going to be. And nutrition needs to be all of our agendas, not just public, private, rich or poor. It is something that we all need to collectively work towards. So absolutely right, sir. Now let's talk a little bit about the new education policy that has come about, because there is an increased focus now on nutrition in regards to education, because of how important it is to have a well nutritious breakfast for your own cognitive efforts. So what do you think about these steps that the government has taken, and what impact do you think they're going to have?
Well, it's one of the best things that we've seen in recent years. We've always known, and science had proven the need for children to be, hungry child doesn't learn. I mean, you don't need a randomized controlled trial to prove it, though we have many that says that the skills are better. So though the traditional rationale why we always fed the hungry was you feel good and they feel good. But you have scientific evidence to show that a hungry child cannot concentrate or learn. Our school feeding programs have been one of the greatest success that I have seen in public health, in the sense that it is a program which has slowly and steadily continued to be learning by doing. It's not a program. When they started, there were many skeptics who said how it would be done, and we always had some food poisoning somewhere, some fire accident somewhere, and the skeptics kept shouting. But slowly and steadily we have improved, and everywhere that you go, the school feeding program is improving day by day, is providing more and more nutritious food to children. And the biggest part is this tremendous amount of local self-governance participation, as well as their contribution to improving it. In that light, now taking it another step to say that we would provide them a breakfast, as well as in the policy taking on the early years of learning, the preschool learning, and concentrating on that are very, very good steps, and the very good steps which would pay very rich dividend.
That's great to hear, sir. And we look forward to all the positive impact that this reform is going to bring about. With that, sir, we've come to the end of our interview. Thank you so much for being here. It was an incredibly insightful experience to hear from such an industry leader like you. And it is our hope that through these series, we are really making nutrition an important agenda for everyone. So thank you for participating, sir, and we wish you all the best, sir.
Thank you, Amini. Thank you very much.